webinar. Every week we have a webinar, and this was started last year when the request you to start the Holy Quran.
Right. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إن هذا القرآن يهدي للتي هي أقوم ويبشر المؤمنين الذين يعملون الصالحات أن لهم أجرا كبيرا وأن الذين لا يؤمنون بالآخرة أعتدنا لهم عذابا أليما. तर्जुमा, ये कुरान वो रास्ता दिखाता है जो सबसे सीधा है और मोमिनों को जो नेक अमल करते हैं बशारत देता है कि उनके लिए अजर अजीम है, और ये भी बताता है कि जो आखिरत पर ईमान नहीं रखते उनके लिए हमने दुख देने वाला अजाब तैयार कर रखा है. सदक़ल्लाहुल अज़ीम.
Thank you, Professor Zahid, Professor Rashid, for this recitation of Holy Quran. अल्लाह के बाबरकत नाम के बाद मैं देख रहा हूँ मेरे पुराने दोस्त डॉक्टर जैदी साहब फ्रॉम सऊदी अरेबिया. He is there. Welcome, sir. Professor Salma Kundi, President of PMA, is there. Welcome, madam. We are starting this. Dr. Haider, now
Thank
it is
you.
over to you. I think you introduce yourself because it will be better that you introduce yourself.
शुक्रिया बहुत बहुत. सबसे पहले तो बहुत शुक्रिया आप लोगों का कि आपने अपना वक्त निकाला इस छोटी सी कोशिश में पार्टिसिपेट करने के लिए. थैंक यू वेरी मच प्रोफेसर बुखारी के आपने मुझे मौका दिया ये वेबिनार प्रेजेंट करने के लिए. मेरा नाम है डॉक्टर एजाज हैदर. I'm a general practitioner in the UK. So I grew up in Germany, in Berlin, did my school and medical school there, and then kind of came to the UK to work. I worked initially in a few surgical rotations and then switched to general practice. And I've been a general practitioner for 14 years now. और अभी जो है पिछले 10 साल से I'm a partner in a kind of medium-sized 12,000 patient general practice in the vicinity of London. So I'm working in...
Dr. Haider, our main objective of the discussion will be on vaccine. But there is now, from the last 2 days, we are hearing about Delta Cron. If possible, in few words, you will also. हम सब खौफज़दा हैं कि कोई नई चीज़ आ रही है. Delta Cron is in UK. Thank you very much. Thank you very much. It is over to you.
No, ये क्या कहते हैं variants के बारे में भी थोड़ी बहुत बात करूँगा. I've been kind of involved in the vaccination drive in the UK from December 2020. Our surgery was one of the first sites in the county to administer the vaccines right from the beginning, from December 2020 onwards. So मैं अपना screen जरा share कर रहा हूँ. आपको सबको, let me just have a look. आपको सबको दिख रहा है मेरा screen या?
Yes, it is convenient.
ये क्या कहते हैं similar क्या कहते हैं webinars इससे पहले इमामिया मेडिक्स इंटरनेशनल के थ्रू हमने दी हैं. So it's kind of mainly about COVID vaccines, and I will focus on a few kind of common questions, frequently asked questions, which have been raised about the vaccines, worries which our community particularly, but also the community in general has faced. Yeah. So first of all, just a kind of recap of COVID. As you all know, on the 31st of December 2019, the Chinese CDC kind of acknowledged the emergence of a new viral pneumonitis with a higher than usual death rate. It was identified as coronavirus 2019, COVID-19, SARS-CoV-2, similar to SARS-CoV-1, which occurred 16 years earlier in 2003. Up to date, and these are the numbers from the Johns Hopkins Public Health Coronavirus Center. Up till now, officially 455 million cases, 6 million deaths, and around 10 billion doses of corona vaccines given. So it's kind of quite interesting. I mean, 10 billion doses, most of them given in high economy or richer countries, where unfortunately in middle and lower income countries, the vaccination rate is less. But yeah, so no one can say now that there's no experience with these vaccines. There has been lots of experience with corona vaccines. This is just the impact on kind of the population, on deaths. The IMF, the International Monetary Fund, reckons that the total cost of COVID so far, in the sense of health cost, economy cost, loss working, loss of GDP, has been around $12.5 trillion, which is around about half of the GDP of the United States pre-COVID. You know, just to give you a bit of an idea. So 6 million deaths officially, but I don't think that's the full picture of COVID. There's something called excess mortality, and there has been actually a paper which just came out last week in the Lancet, where the excess mortality globally and for global regions in each country has been calculated by the COVID-19 excess mortality collaborators, which is a kind of group of public health physicians, public health scientists across different universities and institutions across the world. And they have actually estimated that the real number of deaths, either directly or indirectly affected by COVID, is 3 times as high, around about 18 million. And with direct and indirect, I mean direct people who directly died of a COVID infection, but also because the COVID pandemic severely affected the healthcare systems. People who had other medical conditions could not be seen, could not continue their treatment, their medication, etc., and as a consequence of that died. So what this COVID excess mortality collaboration group did, they actually didn't just look at COVID diagnoses, they looked at the overall death rate in different countries. For example, there have been kind of higher excess mortality in the US of 1.13 million compared to the official tally of COVID of 8.24 million. In Pakistan, 664,000 compared to 28,000. So that's kind of one of these things. Interestingly, I've put this kind of slide up, which kind of describes COVID infection and COVID deaths in Britain. So the data is from the UK Health Security Agency, kind of Public Health England. And you can see on the top is the number of cases reported, and at the bottom, the number of deaths. So early in 2020, there was hardly any COVID testing happening in the UK. So there was certainly no community testing. The only people who got tested for COVID were patients who were admitted in hospitals. So that's why we don't have a peak in March, April. But then we started testing in summer 2020, and then obviously winter 2021, 2020, 2021, and again kind of from October or from autumn 21 onwards, the number of kind of cases increased. The number of deaths were kind of immense in April and March 2020. That was the first wave where we had around 800 to 1,000 deaths per day. Then the second wave, which was more devastating, led up to 1,200, 1,300 deaths per day. And that was when the incidence of COVID positive tests was around 50,000. Now kind of fast forward to sorry, now fast forward to winter 21-22, where we had the remnants of the Delta variant, but also the Omicron variant. So we had a case load of around 150, 160, 170,000 cases per day, but the death rate was below 200 cases per day. Compare that to last winter, 1,300 cases per day. And the simple reason for that has been vaccinations, of course. So kind of substantial percentage of patients, particularly elderly patients, were at least double, if not triple vaccinated, and that caused a decline in the death rate. Public Health England in September had estimated that through the vaccination program in the UK alone, 106,000 deaths and 230,000 hospitalizations were prevented. So a huge relief for the NHS. Quickly wanted to touch on one question which a lot of people who are vaccine hesitant ask. How come the vaccines were developed so quickly, so fast? It takes years and years for vaccines to be developed. So there are four main reasons that I usually point people on. One is the speed of development. So we had overlapping phases of clinical trials. We had fast track approval of the trials by authorities. I mean, anyone who has conducted a trial knows how long it takes to get ethics approval of the trial, etc. Then the vaccines were approved via fast track mechanisms by the authorities once they had reviewed the data on the vaccines. And of course, health authorities in each country had given the highest priority to COVID vaccines. Everything else was kind of pushed to the back. So most vaccines had initially been authorized by emergency use authorization. A lot of vaccines are now normally authorized. The second thing is technology. There has been in the last 15 years a huge advance in technology, vaccine development technology, molecular biology developments, molecular genetics, etc. And then you need to kind of remember that research is not isolated. So you don't kind of just start research on COVID and nothing else has happened before. There has been research on SARS in 2003, MERS, which is another coronavirus which caused Middle Eastern respiratory syndrome around kind of 2012, 2013. There has been a huge amount of knowledge and research on vaccines with HIV and other viruses. And all these, although that research didn't result in a viable vaccine, the knowledge from that research came to use now. And there has been an unprecedented cooperation amongst international research institutions, universities, etc. I mean, you can go and look at the British Medical Journal, New England Journal of Medicine, Lancet, and all papers on COVID are free. You don't need to pay for these papers. You don't need to kind of subscribe to the journals, etc. The third important point was recruitment. So there was a large number of volunteers, very quickly recruited, and there was a high level of disease. And that's why the trials were kind of conducted with relative speed. And then obviously there's been funding. The US government alone contributed $18 billion to research kind of on COVID. And also they paid the companies in advance to set up production facilities while the research and the trials went on. And that was obviously all public money, taxpayers' money. Now, one question I wanted to kind of focus on and mention is pregnancy. So many women are kind of worried or have been worried about being vaccinated when they're pregnant. Now, we have to kind of recap a little bit how COVID and how viral infections affect pregnancies. Now, it's been known for a number of years that pregnant women are particularly at high risk of severe outcomes in influenza, in flu. So for the past 10 years, at least here in the UK, and I'm sure in other countries as well, pregnant women are on the high priority list for flu vaccinations, for influenza vaccinations, for the annual influenza vaccinations. Initially, we were not sure how COVID would play out in pregnant women, but there have been some papers and research. There's a good summary from Jacobocci in the BMJ showing that pregnant women, particularly in the last trimester, are at higher risk of severe COVID. And with that higher risk of severe COVID comes a high risk of preeclampsia with possible birth complications. They are also at double the risk of premature births when they get COVID. And that can even happen if they had mild COVID early on in the pregnancy. The risk of premature births and miscarriage is kind of increased. Now that's for COVID infection. Now, when the initial phase 3 trials were done for the COVID vaccines, be it AstraZeneca, Pfizer, or Moderna, pregnant women were excluded from the trials. But actually what happened is during the trials, some women fell pregnant and they were separately analyzed. And also once the vaccine rollout happened, a lot of women kind of fell pregnant or didn't know they were pregnant when they took the vaccine, or fell pregnant later on. And there has been kind of papers in the US which kind of analyzed kind of pregnancies and vaccinations. And there has been a kind of paper from Shimambukuro, I think that was in June 2021, where they looked at the vaccine adverse effects register and particularly looked at pregnant ladies and compared them with pregnant ladies who had not been vaccinated. And there were no kind of increased rates of side effects, premature delivery, premature babies, miscarriages, etc., in pregnant ladies who had been vaccinated compared to pregnant ladies who had not been vaccinated. And actually in the US, more than 177,000 pregnancies kind of were successfully concluded where the pregnant ladies were vaccinated, and in the UK, 84,000 pregnancies were completed in women who had COVID vaccinations. And again, there was no increase in premature or stillbirth, and there has been no effect on the newborn baby. And if you think about it logically, it actually does make sense, because the mRNA or the vector vaccine you inject into the shoulder, and that's where the vaccine stays. So the vaccine or the vaccination particles are taken up by the myocytes, by the muscle cells, by the macrophages, and that's where they then present the antigen to the immune system, and that's where all the immune reaction kind of takes place. The vaccine, neither the mRNA nor the inactivated vaccines nor the vector vaccines actually go through the placenta or into the breast milk. And the second thing which I want to kind of stress is, if the mom has developed antibodies to the coronavirus, these antibodies will obviously protect the child in the mother's womb, and it will also protect the child once the child is born, because antibodies kind of last 120 days, 100 to 120 days in the body. So we have seen that with other vaccinations, that moms getting vaccinated, and it protects the baby for the first 3 months after the baby is born. That's why I think a few years ago, 8 to 9 years ago, in the UK, pregnant women were advised to have the diphtheria vaccine to protect their babies in the first few months of being born. Maternal antibodies, again, are excreted in the breast milk, so they protect the baby in the form of IgA, which then kind of is present in the mucosa of the baby's kind of oral cavity. So breast milk, if the breastfeeding mother is vaccinated, again, the vaccine itself is not transferred into the breast milk, but the protective antibodies which the mom produces, that's kind of transferred through the breast milk. So COVID vaccinations, no adverse effect on pregnancy or breastfeeding, but it protects both mother and baby from COVID. Yeah? And there are a couple of papers from Shimambukuro and from Shuk kind of describing these findings. Yeah. Sorry, what's happening now? Sorry. Yeah. Fertility, another kind of common question asked by a lot of patients is it going to affect, is the vaccine going to affect my fertility, male and female? Now, some women have reported changes in their female cycle after vaccinations, and that's kind of across the board with the COVID vaccinations. But these effects are only very temporarily, and you often see effects on the female cycle after flu vaccines and other vaccinations as well, because what vaccinations do is they stimulate your immune system, so they cause a harmless but low level inflammation and infection. Women also obviously get changes in their female cycle when they actually are affected by COVID itself. So when they get a COVID infection or when they get a flu infection. So, but these changes are only kind of temporarily. And as I said, during the COVID vaccine trials, actually some women fell pregnant just before taking the vaccine or after having the vaccine. Some women didn't notice or didn't know that they were pregnant when they enrolled into the vaccination trials. And there has been a paper by Victoria Male in April 2021 in Nature. She actually looked at all the trials from Pfizer, BioNTech, Moderna, and AstraZeneca, and actually kind of collected the women who fell pregnant, and there's really not much difference. So in the Pfizer control group, the vaccine group, out of 18,000 participants, 12 women fell pregnant. In the control group, out of 18,000 placebo patients, 12 fell pregnant, and out of the vaccinated group, 18,000 participants, 11 women fell pregnant. Similar numbers, 7 and 6. 9 and 12 for other vaccines. So there's really no difference in the fertility or in the rate of pregnancies amongst control placebo groups or vaccinated groups. Yeah? So that's a reassuring sign. Hilson in October 2021 published a paper in The Lancet where he analyzed just the AstraZeneca phase 1, 2, 3 studies. In these studies, again, he compared the rate of women falling pregnant in the AstraZeneca vaccine group and in the control group. And again, it's very similar number. So no kind of difference in the number of women falling pregnant. And if you look at the viable pregnancies, again, not a statistically significant difference. In fact, in the vaccine group, more women had a viable pregnancy than in the control group. Yeah. So, and again, coming back to the fact that the vaccine is broken down in the muscle tissue and it does neither reach the ovaries nor the testicles. So neither a COVID infection nor a COVID vaccination will affect your fertility. A common kind of concern is that, particularly relating to the mRNA vaccine will alter my genetics, my DNA, but that's absolutely not the case. Our genes, our chromosomes are made up of DNA, and the vaccine is mRNA. And in the body, you have an abundant kind of number of enzymes which actually destroy mRNA. So once you have the vaccine injected, it's just a matter of kind of days or hours until the vaccine, the mRNA vaccine is destroyed by the body. And for years and years, it has been the difficulty with, research on mRNA vaccines has been going on for the last 20 years. And the biggest obstacle was trying to package the mRNA into a form which then is stable in the body and is not destroyed immediately by the human enzymes. Yeah. All right. Another kind of important concern is complications of vaccines. So you hear from people, I had the vaccine and I felt awful, and I've heard people die after the vaccine, etc., etc. So let's put it into perspective. So on the top, we're looking at COVID, the real thing, COVID infection. 85% are mild to moderate, loss of smell, fatigue, fever, etc. 15% can turn into severe COVID, and that means hospital admission, ITU admission, ventilation, or even death. 30 to 50% of patients who are admitted to ITU die from COVID. The rate is probably less now that we have more significant interventions, dexamethasone, anti-inflammatory medications, etc., etc. Initially, the mortality rate of COVID in general was 2 to 3%. Now it's probably kind of below 2%, 1 to 2%, but still significant. The other significant long-term sequelae or long-term consequence of COVID, even mild or moderate COVID, is long COVID. So 5 to 10% of all COVID infections, be they mild, moderate, or severe, they end up with long COVID or long haul COVID, which can last months or years. We don't know. And it's very closely, the symptomatology is very closely related to chronic fatigue or ME, myalgic encephalitis, characterized by tiredness, breathlessness, chest pain, dizziness, headaches, concentration problems. People are unable to work, and we certainly have a number of patients in our surgery who have been on long-term sick because of long COVID. What are the long-term side effects of COVID years down the line? We don't know. We don't know, honestly. Now we're coming to the green part, the COVID vaccinations. So again, there can be very, very rare occasions of anaphylaxis, particularly with the Pfizer and Moderna vaccine. And that's round about 11 in a million. But the thing with anaphylaxis is it's immediately noticed. So within half an hour or within 15 minutes of the injection. And that's why vaccination sites always have a trained doctor or a trained nurse, someone trained in anaphylaxis, and an anaphylaxis kit. So if someone develops anaphylaxis, you can treat it there and then with adrenaline injections, and you can obviously transfer the patient into the hospital. So rarely an anaphylaxis nowadays is lethal. Then you get the common but transient and harmless side effects. They usually take 2 to 4 days. But they're common. 30 to 50% have either localized swelling, pain, redness, or systemic fever, tiredness, muscle aches. And that's all kind of proof that the vaccine is actually working, that your immune system is dealing with the vaccine and mounting an immune response. So that's a good sign, basically. Then you have certainly heard about these kind of effects of thrombus, myocarditis. So these are serious side effects, but they are very rare side effects. So data from Public Health England and kind of papers published in the New England Journal from Israel, from the US, have shown that these serious side effects are very rare, 1 in 100,000. They can occur 2 to 8 weeks after the vaccination. The most prominent, which has been in the news, is vaccine-induced vaccine-induced thrombocytopenic thrombus, which often manifests itself with venous thromboembolism, pulmonary embolism, deep vein thrombosis, sinus venous thrombosis, and it has roughly a mortality rate, unfortunately, of 20%. Often younger people, younger women particularly, can be affected by that. And that's why the recommendation in the UK and in most European countries have been to avoid the vector vaccines. So these are associated with vector vaccines, AstraZeneca, Janssen. So these vaccines are not recommended for women under the age of 40 and 50 in the UK and the European Union. Then with the Pfizer-BioNTech vaccine, you had occurrences of myocarditis. Again, particularly young men were affected, 1 in 100,000. So again, very, very rare. And rarely these men had to be, or these people had to be kind of admitted to hospital. They were often admitted for a short period for observation, rather than having kind of severe sequelae. And in most of the cases, the myocarditis was transient and mild. There have been some cases of Bell's palsy, again with mRNA vaccinations, but they usually kind of resolve with treatment with steroids, with prednisolone. Now, you will have probably seen kind of messages on WhatsApp and Facebook, don't take the vaccines, you will die after a year. Then a year passed, the messages changed to you will die after 2 years. 2 years passed, now the messages are you die after 3 years and 4 years, and so on and so on. So there isn't really much kind of truth and evidence without it. Do we know about long-term side effects years down the line? We don't know, to be honest. And I mean, as a scientist, as a doctor, you have to be honest, but you can kind of correlate and deduct from previous experiences. So it's kind of an unknown, but it's extremely unlikely, because if you look at other vaccines, other kind of types of vaccines, flu vaccinations, hepatitis vaccinations, long-term side effects can happen in a, again, small percentage, 1 in 100,000, but they usually occur within 1 to 2 months of the vaccination. You don't have the picture where you have the vaccination today and 2 years down the line, 3 years down the line, you suddenly get a side effect. That usually doesn't happen. And even if, how are you going to prove that it's the vaccine? It's kind of very, very unlikely. And you just, with the effect the COVID pandemic had, you just can't wait 3 or 4 or 5 years until kind of you see any kind of until you kind of prove that. And to be honest, in other vaccines like the Ebola vaccination or the malaria vaccine, which has recently been kind of approved, nobody waited 5 years or 10 years to kind of look at any rare long-time side effects. So rare long-time side effects, very, very extremely unlikely. Yeah. Yeah, breakthrough infections. So you've had the double vaccination and then Omicron came along and you still got COVID. What's the point of getting vaccinated then, isn't it? So I think you need to kind of look at what you want to achieve with the vaccination or with the vaccine, isn't it? And there are different things that you want to achieve or that you can achieve. So first of all, you can have a vaccination and you cut transmission. The measles vaccine, for example, is a very good example for that. You cut transmission, you don't even get asymptomatic infection. The other thing is you can prevent symptomatic infection. So you can actually prevent the illness. So patients can still be asymptomatic, but you prevent symptomatic infection, or you can reduce symptomatic infection. And then the other important facts are you want to prevent severe COVID. So you want to prevent hospital admissions, you want to prevent ITU admissions, you want to prevent the health system to be overwhelmed. You probably have pictures from what happened in April and May last year in India with the Delta surge. It wasn't just the numbers of people who died from COVID, the whole health system in places like Delhi, Mumbai was kind of overwhelmed. People were kind of not being even admitted for other problems. And then the third thing is you want to avoid death. And there has been kind of a number of real world data studies done. So you might remember the first studies which came out, phase 3 studies, Pfizer, Moderna, the mRNA vaccines reduced symptomatic disease by 94 or 94.6 and 94.1%. AstraZeneca, slightly less effective in reducing symptomatic disease by 74%. The numbers were slightly lower than for, because these phase 3 studies were done with the wild type, with the original COVID. With the emergence of variants, the numbers were a bit less for the Alpha and the Delta variant. And that's why many people who had in the first wave, the wild type, were infected with the wild type infection. So even before the vaccines came in, they got COVID again with the Delta wave. Yeah? But the main thing with the vaccinations were they still held up against severe disease and ventilation, ITU, and death. Yeah? So Kaifang Zhang did a meta-analysis and he published it in the Journal of Infectious Diseases in June, where he did a meta-analysis of 51 studies. And it showed that kind of a course of two vaccinations across all kind of vaccines reduced the risk of a severe course by 97%, reduced the risk of ventilation by 97.4%, and reduced the risk of death by 99%. There was also a study done by Bernal using data from Public Health England, where they kind of analyzed the 4 months of the COVID vaccinations. So in the UK, what happened from the 8th of December, COVID vaccinations were started. We did not adhere to the trial recommendations of having the second vaccination within 3 or 4 weeks of this first vaccination. UK Public Health or NHS England took a little bit of a gamble, but they decided to do the first vaccination and then the second vaccination 12 weeks afterwards. And data actually, which was published in April, which is the paper in the right-hand corner, showed that even after 1 dose of Pfizer or AstraZeneca, these were the vaccines which were predominantly used in the UK, you had a 60% protection or 60% reduction of symptomatic disease, 80% reduction in preventing hospital admissions, and an 85% reduction in death from COVID. Yeah? So even one vaccine had a significant impact on preventing hospital admissions and deaths. Yeah? Right, so you need to look at what you want to achieve with the vaccines. Another point on breakthrough infections is why do you get breakthrough infections? So there's a lot of factors, isn't it? First of all is obviously the time from completing your vaccination course onwards. So it kind of holds up pretty good for 6 months, but then infection seems to wane. And there has been a lot of studies looking at B-cell response, antibodies, immunoglobulins. So after 6 months, you do drop your antibodies against COVID, regardless of which vaccine you use. We don't know much about T-cell response. I think B-cell response seems to be more important in preventing actually an infection and in preventing mild disease, whereas T-cell response, which lasts longer, protects you against severe disease, hospitalization, and kind of COVID pneumonitis. And it has been shown that although after 5 to 6 months, you are more susceptible to get an infection, you are still protected from severe disease. Another factor in why people can get breakthrough infection is obviously reduced immunity. So if you are of an older age, your immune system will work less good. So you will have your immune response will kind of wean down quicker. And also if you're immunocompromised, so if you are on immunosuppressant medications, and a lot of people are, if they have kind of medication for rheumatoid arthritis, ulcerative colitis, these transplants, these medications are immunosuppressants. So again, your immune response initially will be less prominent and will wean down quicker. HIV is a big factor in a lot of countries. So a lot of immunocompromised people with HIV have a kind of lesser immune response to the vaccines. And then, of course, the third factor is virus mutations. So viruses mutate all the time. And we have seen in COVID-19, there has been different variants, alpha, beta, delta, and now Omicron. And with the variants, they have kind of different new properties. So there's For example, for Delta, it has been shown that it has got a higher severity. The Beta variant and now the Omicron variant, these are immune escape variants. So that means that the vaccines, which are all based on the wild type, the original kind of COVID virus, which was sequenced and published in January 2020. So they have a higher immune escape to these kind of vaccines and kind of less of a effectiveness. And then transmissibility, that's the third factor in the variants. The Omicron and the Delta variants are have a higher transmissibility. So Delta is around about 4 times easier transmissible compared to the original wild type, and Omicron around about 8 to 9 times more transmissible, which puts it into the same category like chickenpox, for example. Yeah? So the kind of bottom line is, although protection from infection and transmission can wane, the protection from severe disease and death is still maintained even after 2 vaccinations. Again, a recent paper from the 2nd of March, published in the New England Journal of Medicine. So Dr. Andrews and Stowe compiled data from Public Health England, where they actually compared the effectiveness of vaccines with the Delta variant and the Omicron variant. So on the top graph, you can see the Delta variant as little squares. So immediately within 2 weeks of vaccination, you have a vaccine effectiveness of 94%. With the Delta variant, it gradually then drops after 6 months to around about 50 variant. That's the Oxford, the AstraZeneca vaccine, the top table A. So you had patient had 2 vaccinations or 2 doses of AstraZeneca, initial kind of effectiveness, 80%, which then over 6 months in the Delta variant drops to 50%. With the Omicron, because Omicron is an immune escape variant, the initial effectiveness of 2 doses of AstraZeneca were only 50%, and within 6 months, it had dropped to 0. Now, when you then got a booster after 6 months, the effectiveness, and the boosters here were done generally with either Pfizer or Moderna. So with Pfizer and Moderna, you have a third vaccine or the booster, the effectiveness again jumps up to above 90% for the Delta, and for the Omicron, at least to 60 or 70%. You know? So again, it kind of improves your protection after you've had AstraZeneca from 0 to at least 60 or 70%. The Pfizer, BioNTech, or Moderna, the mRNA vaccines, they had a bit of a better outcome. So again, for the Delta variant, which is the squares, initial effectiveness, 94, 95%. After 6 months, that drops to 60%. For Omicron, with the Pfizer BioNTech vaccine, after the 2 initial doses, the effectiveness was around about 65%, but then over 6 months dropped to around 10%. Again, if you got boosted, the effectiveness of the booster with COVID increased to 70%. And it's actually quite interesting data, showed that Moderna had if you had Moderna as a booster compared to AstraZeneca, in all 3 cases, you had a better kind of protection compared to the Pfizer. So as you can see, if you compare the squares with the circles, with the Omicron variant, you have less of an effectiveness against symptomatic disease. Yeah? Now, the effectiveness against severe disease was still maintained, even if you had 2 vaccinations. And the other important thing is Omicron, Allah shukr, thank God, has been associated with a less severe clinical outcome as well. That was luck for us. So kind of indirectly, the Omicron wave has kind of led to an increase in herd immunity, but it could have been different. It could have been that, I mean, if Omicron would have led to a more severe disease, then again, we would probably have seen very quickly that the health systems would have been kind of overwhelmed with that. Yeah? Right, this is just a list of my references, and yeah, over to questions. Yeah, so I'm just unsharing my screen. Yeah.
Thank you very much, Dr. Aijaz, Haider, for your excellent talk. And really, there are so many questions, not only about the vaccine and about the COVID. There were so many hesitancy you have very explained about the infertility, about breast milk. Initially in Pakistan, they all were afraid. Even the fertility, even the pregnancy. Excellent. There were so many answers present in your presentation. But I would like to ask Dr. Zainab, are you there? Dr. Zainab is on the way. Dr. Zainab, are you there? I hope she, okay. If anybody want to ask the question, yes, if anybody want to ask the question, can
yes.
you raise?
Assalamu alaikum. I'm
Yes,
Dr. Akhtar
you can
I'm
ask the
first time
question.
attending this, and it was very informative talk. I want to ask a few. Actually, I'm a cardiologist, so I would like to ask if anything about the cardiovascular events and vascular thromboembolism. Is there any update about that? Recommendations about the anticoagulation after the COVID infection, or anything which is positively linked with the reduction in the cardiovascular events and thromboembolism?
Yeah, I'm so.
Thank you very much, Dr. Akhtar. We all welcome you in this. Dr. Akhtar from Bangladesh we welcome you, sir, in this session. Dr. Aijaz.
Yeah, thank you very much. Yeah, I mean, I can't probably give you a direct answer because I'm not an intensivist or intensive care kind of physician, so I'm in general practice. But what I've heard from my colleagues is that, at least in the UK now, it's kind of standard procedure. Anyone admitted with COVID to hospital, certainly severe COVID, I think they are given treatment doses of heparin.
Yes.
While they're at least in ITU. Another kind of interesting point, good that you've kind of mentioned this. So when we look at the VITT, the vaccine-induced thrombosis or thromboembolism, the rate of thromboembolism in the real COVID disease is obviously much, much higher than with the vaccination. So I think 20 to 100 times higher risk when you get COVID. So indirectly, even though there is 1 in 100,000 cases of thromboembolism in vector vaccines, the risk is much higher when you get the real thing.
Thank you very much, Dr. Haider.
Dr. Professor Wajir Rahman from Bahawalpur. Dr. Akhtar. Doctor, you can ask the question. Dr. Akhtar, continue.
I wanted to highlight what Dr. Haider actually mentioned about the its safety of the vaccines in pregnancy and and giving protection to the children actually to the breastfeed. That was a wonderful thing. This was new for me, and it's very good information. Thank you.
Thank you. Professor Wajir Rahman from Bahawalpur, you have raised the question. You can ask the question, Dr. Wajir Rahman. Sir, you unmute your mic and ask the question, Dr. Wajir Rahman. Yes.
Sir, my question is about
Professor Wajir Rahman is son of my teacher, Professor Luqman.
Thank you, sir.
आवाज नहीं आ रही सर, please.
Some of our friends and
जी सर आवाज नहीं, we are not hearing you सर.
जी अब आ रही है सर आपकी आवाज?
अब आ रही. Yes, now continue sir.
जी अच्छा, कुछ पेशेंट्स और कुछ हमारे जो है फ्रेंड्स, उन्होंने चाइनीज वैक्सीन जो है ना ये करवाई, साइनोवैक या साइनोफार्म. Now they are scared of getting the booster dose with Pfizer or Moderna. So can they get this Chinese vaccination as a booster dose or as a third dose? My first. And sir, my sir?
Yep.
Okay.
Sorry, मैं जवाब दूं?
Yes, you. It is
So
over
I
to
think,
you.
yeah, I think it depends on the protocols. I'm sure. I mean, in Europe and the UK, the Sinovac and Sinopharm are not approved. मतलब यहाँ नहीं मिल सकते. I'm sure मतलब पाकिस्तान, India, China में protocols for booster होंगे. यहाँ Omicron की वजह से rules थोड़ा बहुत change हुए. Initially, you were eligible for a booster 6 months after your second jab. Now that's been reduced to 90 days, 3 months. So I suppose it will be the same for the Sinovac Sinopharm. One thing though, there has been a study, I think a COVCOM booster study, and usme they have actually shown that if you mix boosters, so if you had AstraZeneca first and then Pfizer as a booster, you have a higher response. Yeah, और इसलिए यहाँ ऐसा ही है कि you can't even get AstraZeneca as a booster. You can only get Pfizer or Moderna as a booster here in UK.
Thank you very much, Dr. Zainab Mukhtar. You are here. Can Dr. Zainab, you are here? Okay.
I can't see her.
Professor Salma Kundi, you always have a question about the vaccine and about the booster. Professor Salma Kundi is president of PMA.
It was a pleasure listening to Aijaz Haider Saab. It was such a nice talk. And I wrote my question, but probably you didn't have a look. It was again about Sinopharm and Sinovac, but like Dr. Seb said, their data in the West and especially in the UK, there's a big gap. They don't have data on the Chinese vaccine. So it's all right. But in Pakistan, we've had booster doses of Sinopharm. I myself have taken Sinopharm, and my 80-year-old mother has taken a booster dose of Sinopharm, and alhamdulillah, we're doing well. So I think we should gather it, and I'm sure they have it in China, which we should look into. Because somehow I trusted the Chinese vaccines more because it was a time-tested technology. That is it. Thank you.
I totally agree. I mean, with the vaccines, I don't have no doubt that the Chinese vaccines are excellent and safe as well. They are inactivated, but the main thing was to get as many people vaccinated as quickly as possible.
Okay, Dr. Qazi Masroor, you are here. Professor Qazi Masroor is the professor. And can you ask Qazi Masroor? We are hearing you, sir.
Sir, it was a really wonderful talk. Though I joined late.
Thank you, sir.
But the way the Dr. Sahab has just given the talk and the way he was answering, I think you must continue these type of lectures. So it is definitely increasing our knowledge, body of knowledge. Thank you very much.
Thank you very much.
Anybody want to ask?
Yes.
My
name is Dr. Mullah.
Yes, you can ask the question.
May I?
Sonia, you can ask the question.
Assalamu alaikum.
Walaikum assalam.
I thank you, Ji. Excellent presentation and very, very informative, covering all aspects of COVID-19. I was just wondering that now when we know that the COVID is fading away, what is the role of getting booster doses?
Okay, very
important. Is there
important
still any role for those who haven't received booster, or shall we go on taking booster every 6 months? So this is my question.
I see Dr. Zainab Mukhtar has joined as well.
Yes, Zainab Mukhtar.
Yeah, I think Dr. Zainab can probably kind of contribute to this as well. But I want to just say you're absolutely right. Omicron is milder. Omicron is just spreading like wildfire. In countries like, for example, South Africa, India, and Pakistan, probably more people have developed immunity because of Omicron rather than the vaccinations. But the problem that I see with the with the kind of spread of the infection is long COVID. So even if you get mild COVID symptoms, there's a 5 to 10% chance of developing long COVID. So I think I would probably, if the booster in 6 months is offered to me, I will take it.
Okay, Dr. Zaina Mukhtar, you have raised the question hand. Dr. Zaina Mukhtar, you were guest today from Germany. Dr. Zaina Mukhtar, over to you.
Assalamu alaikum, everybody. Sorry
Yes,
for being late. And I hope that you guys can hear me. Related to this question, it's an important question. It's an important question about the sustainability, or what you can say longevity of the antibody response. So the data that is coming after the 2 doses, I was supposed to show it today, but unfortunately I had to change my time. But inshallah, I will soon be sharing the data after the 2 doses and data after the 3 doses. But I can tell you that the immune response after the 2 doses is waning after almost 3 months as per the data. And the immune response of the vaccination related to the neutralizing antibodies is waning after 11 weeks. This is what the recent data is showing. And definitely for us as physicians and for population, this is a concerning element. And the vaccine booster is not supporting the idea of protecting us beyond 3 months at the moment, right?
Dr. Zainab, it means we have to continue after every 3 months the booster?
अब ये एक क्वेश्चन है, इसकी एक पैनल है इस वक्त जो इसको डिसाइड कर रहा है FDA के अंदर. मैं इतना बता सकती हूँ कि इस वक्त डिसीजन ये है कि जो वेल नीडेड पॉपुलेशन है, तकरीबन 13 मुल्कों ने इम्यूनो कॉम्प्रोमाइज्ड पेशेंट्स के लिए, एज्ड पॉपुलेशन प्लस 65 इयर्स के लिए और हेल्थ केयर वर्कर्स के लिए, ये इंक्लूडिंग जर्मनी, ये बता दिया है कि आप 3 से 6 महीने के बाद 4th डोज ले सकते हैं. इजराइल का डेटा ये कह रहा है कि 4th डोज इज क्वाइट प्रोटेक्टिव. जो उनका डेटा अभी आया है और हमने देखा है, तो उनके ख्याल में 3 से 6 महीने का ड्यूरेशन पीरियड के बाद आपको 4था डोज लेना पड़ेगा. अब ये बात बिल्कुल ठीक है जो हमारे पास क्वेश्चन आ रहा है पॉपुलेशन से कि क्या हम ये बार-बार वैक्सीन लेते रहेंगे. इट इज अ वेरी जेन्युइन आस्क फ्रॉम द कम्युनिटी दैट दिस इज नॉट अ लॉन्ग टर्म सॉल्यूशन. So let me tell you that we are trying our best to find out the possible combination of variant vaccine in a way that that can be providing more sustainable longevity of the antibodies. And some of the data is still being collected at the moment for that, but this is the present situation. So we cannot say that 4th dose will be mandatory at the moment, but yes, for the immunocompromised population, for aged population, this will be required. And in my experience, I have given this to transplant recipients already. So this is going on at the moment, but for general population, we don't know because it is not yet a mandatory requirement, but seems like it might be needed.
Thank you. Dr. Zishan, you want to ask the question? Dr. Zishan?
Yes, sir. Thank you so much, sir.
Dr. Zishan is from WHO and from Bahawalpur. Thank you, Dr. Zishan, for joining from WHO.
And thank you so much, sir, for you and Dr. Saab, sir. And excellent presentation. I have just not the question and actually the need a guidance from respected sir. Here in Pakistan, actually we are going to including the age group of 5 to 12 for COVID vaccination. So what is the safety values between this age about the COVID vaccine? And secondly, for the safety data, actually at the national level from the WHO side, I am the focal person for collection of these data and reporting to the international level. We see that here in Pakistan, initially we start the Chinese vaccine, and the results of the Chinese vaccine are very successful. But when we started the mRNA vaccine like Pfizer and Moderna and other vaccines, the AFI's cases are rising, and the data of the mRNA safety data actually the very high as compared to the Chinese vaccine. So I have a question that what is the exact numbers about the side effect or AFIs are recorded in the UK or in other countries? If they have, so provide us and or discuss. Thank you.
Dr. Aijaz or Dr. Zainab?
I can take this question. So Dr. Zishan, सबसे पहले तो मैं ये बता दूं कि जो प्रेजेंटेशन का हिस्सा अभी आपने नहीं देखा और इंशाल्लाह हम प्रोफेसर साहब के साथ उसको दोबारा अरेंज करेंगे, उसके अंदर हमने ये सारी चीजें रखी हुई हैं. इनफैक्ट उसमें आपको सेफ्टी प्रोफाइल ऑफ द वैक्सीन्स के ऊपर हम डिस्कशन भी करेंगे कि मुख्तलिफ वैक्सीन्स के क्या रिजल्ट्स हैं और डेटा क्या कह रहा है. मैं समराइज करके इतना बता सकती हूँ कि पाकिस्तान के डेटा के बारे में मुझे पता नहीं है, लेकिन जो वर्ल्ड वाइड डेटा कलेक्शन जो यूरोपियन ट्रायल्स की हो रही है और उसका जो डेटा है और जो FDA के पास जो डेटा गया है, उसके हिसाब से पीडियाट्रिक प्रोफाइल का डेटा आपको मार्च के बाद मिल जाएगा. This I can tell you because this is being submitted at FDA right now for the messenger RNA vaccines, or this will be included in the investigational brochure of the product as well. And the safety profile is quite good for the pediatrics. So this is the data that you will be getting very soon as well in the publications.
Dr. Zishan, that is I was holding these questions. Next week, Dr. Zainab will present about this vaccine. Dr. Mariam and Dr. Rana Naheed Rana, they are gynecologists, very known gynecologists. And there were hesitation, especially in the pregnant mother and in breast feeding. Can you share your some idea, Dr. Rana Naheed Rana or Dr. Mariam, if you are there? Dr. Naheed Rana is my class fellow and Dr. Mariam is gynecologist in Muzaffarabad, Kashmir.
Thank you very much, sir, for asking this very important issue. Yes, there is a lot of hesitation amongst pregnant and lactating women regarding vaccination for COVID-19. Though from the very beginning, we are advocating its safety and use in pregnant women, but still we are facing this difficulty that women usually they prefer us. They say that they'll prefer staying home rather than getting vaccinated. So there is a dire need to advocate the safety of this vaccine amongst pregnant and lactating women through social media and other media campaigns, though we are doing it at a local level, but there is a need to do that advocacy at a broader level so that many of the women, they should get vaccinated, and this hesitation should be, it should be discouraged. Thank you very much.
Thank you, Dr. Mariam.
Yeah, okay, if I can add in, I think, yeah, I think that's a very important point, kind of communicating it to our kind of to the pregnant women, to our community in kind of easy words. But I think you also have to kind of put it into perspective. What happens when you're pregnant and are getting COVID, and the chance will just get higher and higher. I mean, Omicron is so transmissible. It's even if you just stay at home in your own camera, it's difficult to avoid it. So the risk with not being vaccinated versus the safety profile of the vaccinations. Yeah.
May I add, I'm also a gynecologist.
Dr.
Yes.
जी डॉक्टर नाहिद राना.
Professor Mulazim Saab, can I speak? Dr.
sir.
Qazi
Ji, sir.
Wasif.
Ji Qazi Wasif
Thank you
Saab,
very much. It was
President of
excellent
Somalia. Thank you, sir.
presentation. It was excellent presentation. My question is regarding the number of boosters, because in Pakistan nowadays, after those Chinese vaccines, we have from the government, and NCSC has advised for 2 boosters. After 6 months, we get third dose, and after the third dose, we get the 4th dose after 28 days. What is the importance of getting 4th dose, 4th jab after the 3rd dose, 28 days after the 3rd dose? So that's the policy being adopted. Is it really necessary, or is it the excessive vaccine available to the Pakistani government that they want to utilize it as a 4th dose? I mean, it's they are advising for the 4th jab.
Dr. Zainab, Dr. Zainab is working on vaccine in Germany. Unfortunately, we could not continue because it will be lengthy lectures. Next time, we'll have so many questions and answers with Dr. Zainab. Dr. Zainab, can you answer this question of Dr. Qazi Saab? Dr.
जी सर, ये क्वेश्चन बहुत वैलिड है, और यही बात बतानी है कि इस वक्त जो है, ऐसा नहीं है कि वैक्सीन के 3रे डोज के बाद के रिजल्ट्स अच्छे नहीं हैं. न्यूट्रलाइजिंग एंटीबॉडी टीटर आफ्टर द 3rd डोज, जो डेटा जर्मनी का है, उसके हिसाब से 70% प्रोटेक्शन अचीव हो जाती है अप टू 12 वीक्स आफ्टर गेटिंग द 3rd डोज. अब इसमें मसला ये आ रहा है कि 2 तरह की एंटीबॉडीज होती हैं. एक नेचुरल इम्यूनिटी की एंटीबॉडीज होती हैं, और एक न्यूट्रलाइजिंग एंटीबॉडीज होती हैं. 3rd डोज के बाद ये देखा गया है कि तकरीबन 3 महीने के बाद न्यूट्रलाइजिंग एंटीबॉडी टीटर कम हो रहा है, और वो कम होते होते 40% तक आ जाता है. कुछ लोगों में जल्दी कम हो रहा है, कुछ लोगों में स्टेबल रह के फिर भी 40% तक आ जाता है. अब 40% का टीटर जो होता है न्यूट्रलाइजिंग एंटीबॉडीज का, इट इज नॉट कंसिडर्ड टू बी प्रोटेक्टिव. जब मैं अपनी प्रेजेंटेशन करूंगी, उसमें आई विल एक्सप्लेन कि प्रोटेक्शन लेवल को किस तरीके से कैलकुलेट किया जाता है. लेकिन 4th डोज इस वक्त जरूरी है उन पॉपुलेशंस के लिए जो कि इम्यूनो कॉम्प्रोमाइज्ड है, जिन पर एक्सपोजर ज्यादा है, जैसे हेल्थ केयर वर्कर्स हैं, या जो अबव 70 इयर्स ओल्ड है. तो जर्मनी के अंदर भी, और आई एम श्योर यूके के अंदर भी, ये इस वक्त आ चुका है. 22 फरवरी को जर्मनी में आई है रिकमेंडेशन to give the 4th dose to this vulnerable population, which is now in the books, and it has been recommended by various bodies that are responsible for the decision of the vaccines. तो ये ऐसा नहीं है कि इजाफी वैक्सीन है तो लगा रहे हैं, ये ऐसा नहीं है, जरूरत है.
Yes, thank you. Dr. Naheed, you want to ask something? Dr. Rana Naheed? You can unmute your mic and you can ask the question. Dr. Rana Naheed Rana. Okay. Dr. Fazia Farah, you want to ask the question?
No, sir. It was a nice talk. I didn't raise the hand. Assalamu alaikum.
Okay, thank you very much. I think it's a very interesting topic, and now we are going to end. I will request President of PMA, Professor Salma Kundi, to say the thanks and to close the session. Inshallah, we will meet next week with the talk of Dr. Zainab. She is working in Germany on the different aspects of and development of vaccine. And the question is that what are the different things, important things, how can we improve the longevity of the vaccine? Inshallah, we'll meet next week. Dr. Salma Kundi, Professor Salma Kundi, over to you.
Thank you so much, Professor Mulazim Saab. I really want to thank you from all the participants' side, because you are the man behind the gun for this webinar. Allah bless you, because since this is the 32nd webinar so far that we've conducted, from courtesy your efforts and from the PMA platform. And another person whom I want to thank is Qazi Wasik Saab, because he arranges all the Zoom for us and the internet facilities, and then he puts it on the PMA website. My special thanks to Dr. Aijaz Haider Saab. It was a lovely talk, Dr. Saab, and we hope to have you more in our programs. Similarly, Dr. Zainab Mukhtar Saiba, thank you so much. And we would like to learn from you, whether it's next week or the week after that, because we have so many questions which are still unaddressed. It was news for me that Pakistani government is encouraging a second booster dose. How come I'm a doctor and I didn't know about it? Because in KPK, probably it has not been encouraged. It's been done in Sindh. Probably the rate of corona over there is higher. Anyway, I have to thank the PMA fraternity, because it was courtesy PMA that we kept on writing letters to World Medical Association. And because of that, they opened the borders for us Pakistanis who had got the Chinese vaccine. Initially, many countries had closed borders for other types of vaccination. But because of efforts of Pakistan Medical Association, it was accepted by the world community. I thank you, all the participants and everybody who was here. It's such a good learning experience. Allah bless you. Be safe till we meet next week. Inshallah. Allah Hafiz.
Allah Hafiz. Once again, thank you very much, everybody. Professor Aijaz, Dr. Aijaz, Dr. Zainab, Dr. Kazi, Dr. Masroor Qazi, Dr. everybody, my colleague, Dr. Zia Uddin Zaidi from Saudi Arabia, Dr. Akhtar from Bangladesh, and inshallah, hopefully we'll meet you next week at 7 o'clock. Thank you so much, sir. Thank you so much. God bless you.
Thank you. Thank you very much, sir.
Allah sabka hifz aman mein. Assalamu alaikum.